Hi everyone, welcome back to the channel. Today we are going to talk about an incredibly important health topic, 9 warning signs of cancer that you should never ignore. It's important to understand that having one or more of these symptoms does not necessarily mean you have cancer. In most cases, there are other explanations. But these symptoms are signals from your body telling you to investigate further. So let's go over each of these signs in detail. Remember, early detection can make a huge difference in treatment outcomes. 1. Changes in bowel movements. Colon cancer, also known as colorectal cancer, often starts silently, without any noticeable symptoms at first. However, one of the early signs could be changes in your bowel habits. If you notice constipation, diarrhea, or a sudden change in the consistency of your stool that lasts for more than a few days, it's worth getting it checked. Another concerning sign is blood in the stool. Whether it's bright red or darker, it could indicate something serious. In advanced cases of colon cancer, the size of the stool may become narrower, giving it a more pencil-like shape. This happens because the tumor inside the colon may partially block the passage of stool. While this doesn't mean cancer every time, you should consult your doctor to rule out anything dangerous. 2. A sore that doesn't heal. We all get sores or cuts from time to time, but if you notice a sore, lesion, or even a rash that just won't heal, even after weeks, it could be an early warning sign of skin cancer. Skin cancers such as melanoma, basal cell carcinoma, or squamous cell carcinoma can manifest as a sore that stays, bleeds, or changes in appearance over time. Prolonged sun exposure is one of the major causes of skin cancer, so it's always a good idea to limit direct sunlight, wear protective clothing, and use sunscreen regularly, especially if you spend a lot of time outdoors. If you see anything on your skin that concerns you, a quick visit to a dermatologist can put your mind at ease. 3. Unusual amounts of bleeding. For women, changes in menstrual bleeding patterns are often the first clue that something might be off. Typically, a menstrual period lasts about 5 to 7 days. If you notice prolonged, heavy, or irregular vaginal bleeding, it could indicate a number of conditions like hormonal imbalance or uterine fibroids. But in some cases, it could also signal cancer in the reproductive system, such as uterine, cervical, or ovarian cancer. If you experience spotting between periods or after menopause, it's especially important to consult with an obstetrics gynecologist. Don't ignore these signs, because early detection can make all the difference when it comes to treatment. 4. Lump in the breast or other body parts. One of the most well-known signs of breast cancer is the presence of a lump or mass in the breast tissue. If you discover a new lump or thickening in your breast or underarm area, it's important to get it checked out, even if it's painless. Not all lumps are cancerous, but they can be a sign of breast cancer, especially if the lump is hard, has uneven edges, or grows over time. If you have a family history of breast cancer, you may be at a higher risk, so it's especially crucial to perform monthly self-examinations. This way, you can become familiar with how your breasts normally feel and quickly spot any changes. Additionally, make sure to schedule regular mammograms based on your doctor's recommendations. Remember, this applies to other parts of the body too. Any unexplained lump in areas like the neck, abdomen, or groin should be evaluated by a doctor. 5. Difficulty swallowing. If you've been experiencing persistent difficulty in swallowing, this symptom should not be ignored. While it may be caused by something as simple as acid reflux or a throat infection, persistent swallowing problems can also be linked to cancers in the esophagus or throat. Sometimes an underlying thyroid problem, such as a goiter or even a tumor in the neck, could make it hard to swallow. This is why it's important to visit an ENT specialist, ear, nose, and throat doctor, for a thorough examination if the symptom persists. 6. Changes in mole appearance. Moles are common, but certain changes in a mole's appearance can be a warning sign of melanoma, a serious form of skin cancer. Dermatologists often use the ABCD rule to help identify suspicious moles. A. Asymmetry. One half doesn't match the other. B. Border edges are irregular, ragged, or blurred. C. Color. There may be different shades of brown, black, or even red and blue. D. Diameter. The mole is larger than 6 mm, about the size of a pencil eraser. E. Evolving. The mole changes in size, shape, or color over time. If you notice any of these signs, don't delay. See a dermatologist for an evaluation. 7. A cough that won't go away, or hoarseness. We all get the occasional cough, especially after a cold or flu. But if a cough lasts more than a few weeks, it might indicate something more serious. Chronic coughing can be caused by smoking, allergies, or respiratory infections, but it could also be an early sign of lung cancer, especially if your cough produces blood-tinged phlegm. Similarly, if you experience hoarseness or changes in your voice that don't go away, it might be linked to cancer in the throat or larynx. Either way, it's important to see a doctor if these symptoms persist. 8. Unexplained anemia or pallor. Anemia occurs when your body doesn't have enough red blood cells to carry oxygen to your tissues, leaving you feeling tired and weak. In many cases, anemia is caused by iron deficiency or blood loss from heavy menstruation. But in some instances, it can be a sign of more serious conditions, like leukemia or other cancers affecting the blood. If you experience pallor, extreme fatigue, or unexplained weakness, it's worth discussing with your doctor, especially if these symptoms don't improve with dietary changes or supplements. 9. Sudden weight loss without dieting. Losing weight without trying might sound like a dream for some, but if you're losing weight rapidly without changing your diet or exercise routine, it can be a red flag. Unexplained weight loss of 10 pounds or more over a short period of time could be the body's way of signaling an underlying issue, like cancer. Certain cancers, including those of the pancreas, stomach, or lungs, may cause weight loss due to metabolic changes in the body. If this happens to you, it's crucial to seek medical advice to determine the cause. In summary, if you notice any of these warning signs, it's always better to be safe than sorry. Consult your doctor to discuss your symptoms and undergo any necessary tests. Remember, early detection is key when it comes to cancer. Stay proactive about your health and don't hesitate to seek medical advice when something doesn't feel right. Thank you for watching. I hope this video has been helpful. Stay informed, stay healthy, and take care of your body. Don't forget to like this video, leave a comment below, and subscribe to the channel for more health tips and information.